So hello again, I'm Doreen Tracy and I work for Dotwell. And Dotwell is a partnership between two amazing community health centers in Dorchester, the Dorchester House Multi-Service Center and the Codman Square Health Center. And as I said earlier, we really want to engage you in our big idea, and our big idea is fiscal health vital signs. Our big idea has three main points. One is to integrate financial health into the standard of care in the primary care setting. That means looking at financial health the way we look at other kinds of predictors of disease and disease. Two, we want to diagnose the root causes of poor financial health and to remediate them by leveraging existing community resources. Several folks came up to me tonight and said, oh, we do something like that, or I know someone who does that. And we say, yes, that's great. We want to leverage existing resources, those that are not currently being utilized in our community. And third, we want to improve the financial health of our patients because we know that in improving financial health, we can improve overall physical health. Wealth is a social determinant of health, as I've said before. One of the things we know is that the working poor live in a financial landscape that is unjust, that's expensive, that's predatory, and that is outright unhealthy. This is the environment. This is what is physically there in the communities where the working poor, where community health centers are located. This is what people are exposed to every day. And what we know is that folks on the bottom are getting sick more, having more drastic outcomes from their illnesses, and are costing the system more. We need to make an intervention. So what we see as an opportunity here is a real systems change, that community health centers, because we have patients walking through our doors every day, coming into a trusted environment, that we can make an intervention and we can connect individuals with the kinds of resources that they need to improve their financial health and their overall life outcomes. So we need to be asking the right questions in the right context. And we believe that that right context is in the trusted environment of your primary care home, because these are not easy conversations to have. Again, many of you indicated, yes, you'd experienced financial stress in your life. If I were to ask a follow-up question, yeah, and how many people went around telling everyone that they were under financial stress and needed help? Yeah, nobody. And that's across the economic spectrum. So imagine the opportunity we have to turn a conversation that invokes shame into a conversation that invokes health, because we land it in the context of a community health center. How does fiscal health vital signs work? I'm going to tell you that by telling you a story about Ariana. So Ariana comes in to the Dorchester House Multi-Service Center, and she's there to see her doctor, and they take her blood pressure, and it's high. So when the doctor comes in and says, Ariana, your blood pressure's high, and she says many things, and one of them might be, yeah, well, I'm kind of stressed, I'm behind on my rent, and I can't pay my bills. So our providers have the ability then to make a referral to a case manager who is already part of that team, again, a known entity, and that case manager can do the assessment. Now that assessment checks three primary aspects of financial health: capital connections, credit connections, and social capital. Once the case manager has worked with the patient, they together, acting in a coaching way, develop a wellness plan. And the result is reduced stress, improved health outcomes. This works, and we know that it works. What we're proposing here is systems change. And again, I've had some amazing conversations tonight with folks, and folks are saying, yeah, that sounds like, somebody, we're doing that kind of. And I'm like, yes, absolutely. This is not, some crazy thing that dropped from a spaceship. This is complete common sense logic. But what we're doing is we're moving this conversation, again, into a health conversation. We know we have impact. We really believe in this model. What we need is about $700,000 over the next 2 years to continue our systems improvements to the model as we're using it right now at the Dorchester House. We want to expand into our second community health center, our sister health center in Dotwell. That's the Codman Square Health Center. And we do have a vision of replicating. There's interest in this in other community health centers in Massachusetts and beyond. So again, Yes, financial support, but we also want your social capital. I can tell you this. I want you to talk to other people about this. I want you to tell them about our big idea, and I want you to help us engage other folks that you know who are not in this room, who may be able to connect us with folks who are interested and excited about this idea. I just want to remind everyone that we're having impact. We know it works, but we've got to do more. We have got to do more, and we can't do that without you. We've got to do it together. We've got to integrate financial health assessments as part of a standard of primary care at health centers. We need to diagnose financial health problems and remediate them. We need to do more. We need to create financial health in our patients to improve their overall health outcomes. We need to do more. We need to do that together. So I'd say, let's go. Thank you.